Okay, so Bache, let us start with our first and one of the easiest topics in general pathology, that is cell injury. Now, starting with cell injury, देखो, normally cell is in a state of homeostasis. Homeostasis मतलब it is able to perform all its functions well. In case of an injurious stimulus, in case the cell receives an injurious stimulus, that is, in case of an injurious stimulus, the cell tries to adapt itself. It undergoes cellular adaptations. It undergoes cellular adaptations. Now, there are four main cellular adaptations. There are four cellular adaptations, which are hypertrophy, which are hypertrophy, hyperplasia, hypertrophy, hyperplasia, hyperplasia, metaplasia, metaplasia, and atrophy. Metaplasia and atrophy. So, a cell can adapt itself by four techniques, that is, hypertrophy, hyperplasia, metaplasia, and atrophy. If the cell is able to adapt itself, अगर वो adapt हो गया तो ठीक है. If the cell is able to adapt itself, fair enough. Otherwise, it undergoes cell injury. Otherwise, it undergoes cell injury. Cell injury, it is of two types. It can either be reversible cell injury or irreversible cell injury. It can either be reversible or irreversible. Irreversible cell injury is further of two types, that is necrosis. It is further of two types, that is necrosis and apoptosis. Necrosis and apoptosis. Whatever we have written on this slide, we'll do that one by one. This is your topic, cell injury. So let us start with our first cellular adaptation, that is hypertrophy. पहले वाली से शुरू करते हैं, that is starting with hypertrophy. Starting with hypertrophy. Hypertrophy, अब देखो, think of it yourself. Rank 1 to 3, everybody gets one trophy only, but the size of the trophy is different. So hypertrophy, it is an increase in size या number. It is an increase in size of the cells. It is an increase in size. So does it occur in dividing cells or non-dividing? Number is not increasing, just the size is increasing. So it occurs in non-dividing. It occurs in non-dividing cells. Next point, does it predispose to malignancy or does not predispose? For malignancy or cancer to occur, the cells need to divide. So this does not. This does not predispose. This does not predispose to malignancy. Does not predispose to malignancy. Next point, very, very important. What are the examples of the same? Starting with hypertrophy. देखो, we have already seen it is seen in non-dividing cells. Non-dividing cells कौन से होते हैं? Which are the non-dividing cells? These are the permanent cells. Non-dividing means these are the permanent cells. We'll do it in our next chapter, that is inflammation. We'll divide cells on regenerative ability into three types: labile, stable, and permanent. Labile are the continuously dividing cells versus permanent cells, which are non-dividing in nature. So, which muscle are permanent cells? तीन मसल है. मसल्स आर ऑफ थ्री टाइप्स: स्केलेटल मसल, स्मूथ मसल एंड कार्डियक मसल. कौन कौन सी परमानेंट है? एग्जांपल्स, विच आर द परमानेंट मसल्स? दैट इज स्केलेटल मसल एंड कार्डियक मसल. So the first example of hypertrophy is skeletal muscle of bodybuilders. Hypertrophy, which is the first example, is skeletal muscle of bodybuilders. Next example is cardiac adaptations. Next is cardiac muscle or cardiac adaptations in hypertension. Cardiac adaptations in hypertension. Next, put a star, again important, uterus, that is gravid uterus. First tell me this, in pregnancy, gravid uterus or a pregnant uterus, it is how many times larger than a non-gravid uterus? As compared to a non-pregnant or a non-gravid uterus, gravid uterus is 3.5 to 4 times the size. So uterus in pregnancy. Next is uterus in pregnancy. Uterus in pregnancy, it undergoes combined it is combined hypertrophy plus hyperplasia. Both the number as well as the size of the cell is increasing. It is combined hypertrophy plus hyperplasia, but predominantly hypertrophy. But predominantly hypertrophy. Both the size as well as the number of cells are increasing. Size as well as number is increasing, but it is mainly an increase in size of the cell, predominantly hypertrophy. Next example is put a double star, breast. Again, very important, breast. देखो, I can divide the female cycle into 3 phases: puberty, pregnancy, lactation. In the first 2 phases, that is puberty and pregnancy, both number and the size increases. So let me write this below here. Breast in puberty and pregnancy. नीचे लिखते हैं, that is breast in puberty and pregnancy. In puberty and pregnancy, it is combined hypertrophy plus hyperplasia. दोनों बढ़ा, number as well as size of the cell increased,